Hey everyone, I am just going to go over central lines really quick. Short video, really a supplement or just something like a visual for you, for people that like visuals to just see the actual central lines. Of course, it's not a full lecture. Like I said, it's a supplement, just a visual to show you the lines, give you some pointers. So first, I want to tell you exactly what is it, what are we talking about? We're talking about CAD, or central access device, or sometimes referred to as a CVC, which is central venous catheter. And then often you may even see it written or somewhere as a CVAD, which is a central venous access device. All of these, wherever, however you see it put, is a central line. It's a centrally line that sits right outside the right atrium. So you may see it written or referred to as different things, but a central line is a central line. And that's what we're going to talk about. What are they used for? Why would one need a central line? Well, often a central line will be used for long-term antibiotics. Anyone that you think, that may need long-term antibiotics will often get a central line just to prevent the patient from having to be stuck so much. Same thing with vesicants. Vesicants such as chemo, they're really hard on the veins, and you don't want to just, hurt anyone, so often they'll have a central line. A lot of times vesicants too, they leak out into the veins, and there's a fancy word for that, and I'm probably going to butcher how to say it, but extravasation, when they leak out and cause tissue damage. You've seen, if you've worked in healthcare, you've probably seen something like that. It looks horrible. So you want to have a central line to prevent that. So you want to prevent those vesicants from damaging the tissue. TPN can sometimes be a vesicant as well. It can cause tissue damage. So anytime someone has central parenteral nutrition then they need to have a central line. So keep that in mind. Now you may see, there's also peripheral nutrition, which is a different, less, it's not as strong and it has less additives to it. But peripheral can be given peripheral. But we're talking about total parenteral central nutrition, which is can be hard on the vein, so you have to have a central line for that. And then you can use central lines for hemodynamic monitoring. And you will learn more about that when you learn about the hemodynamics and the heart. We'll talk more about it, but you can use a central line for that as well. So the first one I just want to show you here on, this is Chester Chess, and he is one of our models. And he's just got all the lines here. The only one that he doesn't have, because we don't have his lower half, is a femoral. Now, you will often see a central line put in the femoral. Now, usually with the femoral, it's definitely increased risk of infection, because you got to think about where that is. But sometimes they will use the femoral if the other places are not available, or if if they're in a hurry, or it just depends. So you may see a central line access device put in the femoral artery as well. So the first one up here is the jugular, and as you can see, there's a 1 lumen, but sometimes you'll see, hardly ever do you see one. I mean, you will, but most of the time there's several lumens, like 2, 3, 4 even, and it goes right there in the neck. And these lumens hang. You will often see a cap on the end that is a decreased infection cap that will be filled with alcohol or chlorhexidine. And those caps are amazing because they have shown to decrease the risk of infection for the patient. And you keep those caps and you put new caps on when you change, when you do anything. If you flush it, don't put the same cap on. Flush it, put a new cap. And this other cap is a positive pressure cap, and that has been, that used to be what they put on there all the time, and it is just prevents the blood from backing down. So it's positive pressure, so it keeps it from, from the blood just filling that up. And sometimes if you have a good blood flow or bounding pulse or whatever, or patients moving around a lot, sometimes you will see a little blood back up, but most of the time you won't see it all the way to the end because of this cap. Sometimes most of them have clamps, and because of this cap, you don't necessarily need to clamp that. I mean, a lot of people do, but you don't have to on the central line, on these type of central lines. We're going to talk about the stat lock, but often you will see this sutured in, or either you'll see it attached here to the stat lock. And Baycare uses stat locks. I don't think everywhere does, so you may see this or some type of device holding this down, but a lot of times it's sutured in. So that's your jugular, and then there's not a picture of the subclavian, but you may even see one inserted in the subclavian as well. And those. So let's see what our next one is. So tunneled. Well, I'm going to talk a little bit more about the tunnel, but this is just the tunneled. Often you will see 1 lumen, sometimes 2. And the tunnel catheters always have these clamps. And I would say just clamp it. It's set up, the tunnels are a little different than the others. It's there for long term. You may have someone that is dialysis or cancer, or for chemo, or even like your rheumatoid arthritis. Anybody with long-term needs may have a tunnel catheter. And then you've got your pick, which you're going to see a lot of. Picks are usually in the arm. They're not always up high. Sometimes they're up here. Sometimes they're down here. Sometimes they're here. So you may see different picks. You may see more than 1 lumen. You may see 1 lumen. Same thing. You're probably going to see a stat lock or sutures holding that in. And then I think your checkoff also talks about, y'all probably did the checkoff in 3, but you want to make sure that these things haven't migrated, so there's usually numbers on them, to make sure. Never ever push it back in anybody. That would be a reason. If it looks like it's migrated, they need an x-ray. We don't push it back in. That's a surefire way to get an infection, right? And because it's going right outside the heart, you don't want to cause an infection to the heart. So just keep that in mind. And then I just labeled this peripheral IV. Of course, we're not talking about peripherals, but that's what that is. Like I said, this is our chest, and it shows all different lines, but our peripheral IV is there. If you notice on these different ones, different lines, they all have caps. This one's blue, the blue and light blue, and I told you about the light blue one and being a decreased infection. And then these others, these are positive. This dark blue is positive pressure cap. This one's white positive pressure cap. So sometimes you see different caps different ways, but they all should have a cap, sometimes 2 caps on them. These should have these light blue caps, these chlorhexidine or alcohol caps, but they don't. But that's an example of one there. Also, I've got you a portacath labeled. You can't see it, it's under the skin, but our next slide shows you the portacath, how it actually looks. And then I told you about the stat lock. So the stat lock is stuck down. It's a big sticky sticker, and then it holds. This would lift up and actually kind of button or clamp into place, and it actually holds. It holds it in without having to have sutures. But again, when you're changing the dressing and you take all that off, you have to be very careful that doesn't migrate if there are no sutures. But usually there are some sutures, and sometimes there's sutures and a stat lock, so it just depends. Like I said, this one's a single lumen. These are single lumens. All of them are single lumens, but you will often see definitely more than 1 lumen. There can be more lumens. Just some points to remember. You want to change the dressing every 7 days per hospital policy. It really depends. Sometimes there's an IV team that does it. Sometimes you do it. And sometimes you do it more than before 7 days. Why would you do that? Well, let me tell you. You would change the dressing if the dressing is loose, right? If it is not completely stuck down on all sides, you would change the dressing. That would be considered a non-occlusive dressing, and it could increase the risk of infection. So if it's not stuck down, if it's loose, if the adhesive is coming up, you would change the dressing. And you never ever want to put any gauze over the dressing. You will use a bio patch, which is the little round disc, but you never ever want to cover up the insertion site. Because why? Why would you not want to cover up the insertion site? Well, you're looking for infection, right? You're having to assess it, and you can't assess it if it's covered. So never ever cover it with gauze. But a bio patch is okay. And you always use a transparent dressing. Always use a 10cc syringe. Always, always, always. Nothing ever bigger, nothing ever smaller. Use a 10cc syringe when you're pulling blood for a sample, or if you're flushing. Flushing, you want to use a push-pause method. That just decreases the risk of it clotting. You've all heard, or if you've worked in healthcare, you've heard of it being clotted. You don't want it to clot. So you have to use a push-pause method. You have to do your flushes to prevent that. And then always use the chest x-ray to confirm. You never want to use it until you've had your chest x-ray. And I told you I had a picture of a porta cap. That's just what the porta cap looks like. It's definitely long-term use, and you have to access it with a special needle called a Huber needle. And I drew a fancy little picture here. It's just the needle is just kind of like a 90-degree angle needle. A lot of patients are given a card that tells you what size needle to access it with. Some people don't have their card, and you have to try, the most common type. But most people have a certain type needle, or it's always a Huber needle, but a certain number that they use with theirs. And then a tunnel catheter, which is here. I wanted to show you really quick the Dacron cuff. And that is the little raised area is called the Dacron cuff, and it has antimicrobial properties in it that helps decrease infection, and it also helps the tunnel catheter to adhere, because you notice it's not sutured in. So that Dacron cuff will help hold it in. So it kind of adheres to the tissue in the vein. For use. And that is all I have. Like I said, this is a supplement, 12 minutes. I meant for it to be shorter, but I might have given you a little more information. But like I said, visual help, and any questions, you can find me, and definitely refer to your full PowerPoint for your central line. But like I said, this is just a supplement for you. Take care. See you soon.